Breast augmentation surgery is one of the most popular cosmetic surgeries done year in and year out. And the purpose of it is not just to enhance the size of the breasts, but also to address any problems with asymmetry and overall create better balance between the breast and the rest of the body. The most important aspect of breast augmentation surgery is getting the right size implant. Too often complications arise because patients want too large of an implant, and it's my job to really guide them into selecting the best breast implant that's going to be the right size for them and not cause any problems down the line. So we begin with a really detailed consultation. I usually spend over an hour with my patients talking about all the different options as far as their implant. The most important thing is to select the right size implant so it doesn't cause any problems down the line, but it still meets your aesthetic goals. So some of the things that I do in the operating room during a breast augmentation is not just to ensure the best results for my patients, but also the safest outcomes. So some of these things that I do involve minimal dissection causing bleeding. So I have very little bleeding during these surgeries. That leads to less inflammation and less pain after surgery. I use specific special antibiotic solutions to cut down on the risk of infection, not just in the early part of surgery recovery, but also long-term. I use a no-touch Keller funnel technique to deliver the implant under the muscle without manipulating the implant at all. And studies have shown that this is the best way to prevent long-term complications such as capsular contracture. So I take all of these techniques that I've accrued over the years to make sure that my patients get the best results and the safest outcomes long-term. The recovery process is very straightforward. Most patients take between 3 to 5 days off from work, and everyone is back to work within a week. I have patients getting back to light stretches and exercises within 2 weeks and then back to the gym by 4 weeks. The surgery is very well tolerated and it's done under general anesthesia and takes about an hour to an hour and a half to do. So what differentiates me from other plastic surgeons is that, number one, I spend a lot of time with my patients. Not only in the initial consultation, but every visit thereafter. You only will see me, not a nurse, not a physician assistant. And I think that's really important in establishing the doctor-patient relationship. I'm going to be taking off every bandage. I'm going to be taking out every stitch. And that's really crucial in understanding the level of care you're going to get at my practice. The other thing is that I spend a lot of time determining what's the best option for you. This is not a cookie cutter operation, and I use my fine arts background and training to determine what's the best implant that's going to make you look great from every angle. And I think that combination of things is what really separates me from the rest of the plastic surgeons.